diagnosis?
The first thing I thought was an ankle sprain, just because it's common for base runners to land awkwardly onto a bag. And you had said that you were rounding second base.
But was this an acute or overuse?
Acute.
Okay. Within an acute injury, what other questions would you ask?
If they've done anything for the injury prior to seeing an athletic trainer. So any treatment, ice. Ask them if it's been bothering them into the night. See if they had trouble, maybe if they had difficulty going up and down the stairs.
What the mechanism itself of injury? That's something that you determine.
Oh, yeah.
In terms of maybe how can you describe the motion, with your other ankle, show what you did exactly.
Okay, yeah.
And maybe get a sense of how much force there may have been. Were you jogging, or were you sprinting?
Sure.
Get an impression about those kinds of things regarding the mechanism. How about observation? What were you thinking there?
Definitely the swelling around the lateral aspect of the ankle kind of gave me an indication that that's where we were going to be focusing on. I didn't feel like there was enough pain over the tibia or fibula to suspect a fracture, but I definitely kept that in mind. But I knew we were definitely dealing with the lateral side of things.
And too, my gait was, an antalgic or looping gait, so that certainly gave you more impression of the inversion sprain. What about palpation? What were you thinking there?
I wanted to check definitely the lateral ligaments, but I also wanted to check the anterior tib fib and the posterior tib fib, just to rule out possibly a high ankle sprain. And also, I wanted to rule out any injury to the medial ligaments, in case there was enough force that you did possibly kiss those.
There's a lateral injury, soft tissue injury, in addition to the ligaments that you might want to rule out to muscles. What muscles would that have been? Lateral side of the foot, ankle, the muscle group there. Inverters.
Makes sense.
I'm thinking of perineals.
Oh, okay, yeah.
And then perhaps perineal muscle strain, maybe a retinacular injury, either on the calcaneus or behind the lateral malleolus, or maybe tenderness at the stylic process of the metatarsal, those kinds of things. So that'd be good differential as well. As you say, rule some other injury possibilities out. What about within the range of motion and muscle testing? What were you thinking there?
With what we had gone through up to then, I was really looking for any pain with plantar flexion and inversion, which you had. I just wanted to also check to see your endpoint for the range of motion, to see how much you had lost. It probably would have been best to check this bilaterally.
Very good.
Have you do it.
Especially range of motion, you would compare right away. Very good. Okay, so let's keep moving. What about special and stress tests? What were you trying to accomplish there?
I wanted to determine any laxity that you would have with an ankle sprain, doing the anterior drawer and the tailored tilt. I wanted to see, if there was any laxity, and if so, how much, and then also if there was any pain effect also. And you demonstrated that with both. And then the Krieger's test is rotating the foot, the forefoot in and out. I just wanted to see if there's any more pain with that.
And maybe some other tests, again, getting into the differentials, maybe a wedge test where you dorsiflex the ankle, test that tip fibula, and then you're trying to rule that out in palpation. You might go continue to rule it out. Then your special and stress test, for example, maybe some perineal tests. I would suggest that when you do your anterior drawer, for instance, your rotation that you are doing, that you have the foot relaxed and the legs, the knee flexed and the foot relaxed over the end of the table. If you perform an anterior drawer in this position, what can happen is the gastroc knee is tight, and if you bend the knee, it relaxes that muscle, and you can get a better test out of it. So, I would perform most of your tests, even the tailored tilt, in a more relaxed position, but staying over the end of the table. Certainly on the field or the court, you have to improvise, which, where you approach it, you have to do it on the field or the court. In this environment, you might want to have it at the end of the table. Okay, so your final evaluation was inverted ankle sprain, and got suggestions for how you might improve it in the future. Those make sense to you?
Yeah.
Okay, well, thank you, Pat. All right, that's it.
Okay.